Let's go ahead and talk about sleep apnea and opioids. Specifically, I'm going to address the issue of sleep apnea and opioids in the immediate post-surgical period, meaning after surgery. There is big issues surrounding obstructive sleep apnea, and if you have sleep apnea, this is an important issue for you. And the concern is that narcotics or opioid medications such as Percocets increase the risk of complications in patients with obstructive sleep apnea after surgery. Specifically, increases the risk of respiratory failure, which of course is a bad thing. However, while that is true, that actually does not tend to happen in the first 24 hours after surgery, provided that the patient is not already opioid tolerant. So, in essence, what I'm trying to say is if you have obstructive sleep apnea and you are not on Percocet type medication before surgery, the first 24 hours after surgery should be okay for you to take opioids without significant increased complication rate. The risk of complication will increase after the first 24 hours. However, by that time, your opioid regimen will probably be adjusted to something that is adequate, as well as you may need opioids less since you will now be 1 day post-operative or 1 day after surgery. The risk from opioids increases on day 2 and day 3 after surgery for patients who have obstructive sleep apnea. So if you're in the hospital, they should be able to monitor you adequately for any type of complications. If you're at home, then yes, certainly erring on the side of less opioids than more opioids or less Percocet type medication than more would be helpful. However, I think the issue has been overblown as far as opioids on the first day of surgery. I think they work very well with minimal complications in patients with obstructive sleep apnea, and they should not be withheld from patients because of fear of potential bad outcomes. Anyways, that's just an opinion. And that's it for this episode of ED Talks.